Coming into CML, it was very apparent to me that, and the way I operate is I like to go externally. I spend a lot of my initial time in my first 100 days out with our great 2,300 staff, as well as meeting with a number of our referring physicians, as well as a number of the patients that go into our 200 clinics across the country. What's apparent to me is today we operate at a scale that is exceptional. Our primary payer, which makes up 94% of our revenue, the governments in this country are struggling with the demographic push as well as the fiscal constraints of the healthcare budget. So really our strategy in its simplest form is to grow and strengthen our core operations, to differentiate our service provision, and to take that, broaden that across new areas and new geographies. The first pillar of our strategy is about scale. Really, the two main pieces of growing the scale are all about, one, quality, and two, speed. So quality in our operations is critical. We're a highly regulated industry. We want to provide high-quality medical diagnostic services to the patients that we serve on a daily basis. And speed, we want to have rapid turnaround of our tests. We are looking at all the processes where we have people, opportunities to enhance and upgrade some of the equipment that we have. We have done that already with our biochemistry platform, just starting it with our hematology platform, and we've got a number of other areas which I believe actually will give us some game-changing technology to put around the great people and improve the processes through which we operate. That will both enhance the speed at which we can respond to the needs of the patients and the physicians, as well as create opportunities for us to add additional tests and get into the second pillar of our strategy as well. It's very important for CML Healthcare to grow through our second pillar, which is differentiating, and we need to differentiate ourselves for a number of reasons. Today we provide a series of critically important but very routine tests on both the lab and the imaging side of the business. So in the future, we want to differentiate ourselves by building on the existing infrastructure of 220 community-based sites that we have across Canada and provide additional services that go beyond the routine services that we're providing today. Those services will come in the form of additional esoteric tests, genetic testing, services that will expand beyond the core, such as allergy services or additional cardiovascular services. We are going to be launching a test called Cologic, and Cologic is a very innovative test that is much easier, simpler blood test for patients who may be at risk of colorectal cancer to take. Today, the tests are rather cumbersome. We're going to be providing patients with a simple, easy opportunity to have a simple blood test whereby they can get guidance as to whether or not they may or may not be at risk for colorectal cancer. Differentiating ourselves on the imaging side of the business is really going to come through expanding the core set of modalities that we provide today, so the core set of imaging services that we provide today. The second area is really around focusing our efforts to service subspecialty markets. We believe there are opportunities within the oncology area, within women's health, as well as within the cardiovascular to really strengthen the menu of services that we provide patients and providers in those areas. We are adding in resources that are really focused on not just serving our existing government customers, but focusing on business to business, business to government, new partnerships. And some of that is going to be taking existing services that we provide, such as the routine tests, but also additional services such as flu shots, immunizations, and other things that our business clientele does value, and providing those services through our CML network. Through those resources, where we haven't had activities in the past, we will make sure that our strategy is effectively implemented. The third pillar of our strategy is really around innovative expansion. What that innovative expansion builds on is the first pillar and the second pillar. So getting our scale and getting our differentiation right to grow to additional geographies where we aren't currently operating today. The ultimate goal that we have is to make CML become the partner of choice for companies that have innovative tests either on the laboratory or diagnostic imaging side. We provide a commercial channel for them to be able to bring those tests to market. And recently we've just signed an agreement with Mars Innovation, which will allow us to have access to many new innovative therapies that we can effectively bring to the market through our community-based network of clinics across the country. The ultimate goal of the new CML healthcare growth strategy will be achieved firstly through the creation of scale by strengthening our core operations. Secondly, differentiating the services that we provide. And thirdly, innovatively expanding into jurisdictions where we don't currently operate. I am confident that we have the right strategy and people in place to make CML Healthcare a world-class medical diagnostic services provider.